Hello, and welcome to the Checkup. I'm Kara Hartnett, the Health Disparities Reporter for Modern Healthcare, and today we're catching up with Dr. Alex Jahangir on how to band together community resources during times of crisis to protect our nation's most vulnerable populations. Dr. Jahangir is an orthopedic surgeon who leads the trauma division at Vanderbilt University Medical Center. He serves as chairman of the Metropolitan Board of Health in Nashville and was appointed by Mayor John Cooper in March 2020 to lead the city's pandemic response. He recently wrote a book, Hotspot, which chronicles his first year of leading the city through the pandemic, in which he reminds us in true trauma surgeon fashion that all bleeding does eventually come to an end. Dr. Jahangir, thanks for joining us today.
Truly a pleasure to be here. Thanks so much for taking this time.
Yeah. And so in your book, you discuss centering Nashville's pandemic response on mitigating health disparities and really paying attention to underserved populations. Tell me about the early days of that response and how it all came together.
Sure. So, the COVID first came to Nashville on a Saturday, March 7th. And very quickly, I think all of us, probably like most of the country, realized this was going to be a much bigger deal than perhaps we had thought. And so on that very first week, that Wednesday, after our first case here in Nashville, I, along with the mayor's office and the health department, brought together a lot of players in the city. Nashville is very fortunate to have three very large tertiary healthcare systems: the Academic Medical Center, Vanderbilt University Medical Center, Ascension St. Thomas, and HCA TriStar. Each of the systems individually had a response plan, but bringing together the leaders of those three medical centers, along with Meharry Medical College, a historically Black college university, Nashville General, as well as nonprofit entities such as the Red Cross and nursing homes and other groups focusing on our less served communities. We brought everyone together literally on that Wednesday to try to figure out a coordinated response. And from there, we built a lot of infrastructure first around testing that really, I think, has helped our community.
Yeah, absolutely. Tell me more about the testing facilities that you guys set up.
Yeah, so I think very early, and in fact, it might have been at that Wednesday meeting, we realized that the best way to see an unseen enemy is to make that enemy visible. And so we realized that testing was horrendous, right? There was no testing really guidelines being given by the federal government. There's not availability. We were seeing examples around the country of testing centers that had lines that were hours and hours long to get a COVID test. And so what we realized is we need to get a broad public access to testing, not only so that people can have access, but also one of the biggest worries then and throughout the pandemic was hospital capacity. And if everyone who got sick went to the hospital emergency department to get a test, obviously we would no longer have the capacity to take care of traumas, heart attacks, and so forth. So again, with these the three health systems I mentioned, as long as with Meharry and Nashville General, we came together in a big conference room. We said, how are we going to get this figured out? And we pulled out this big map of the city of Nashville, and we looked at areas that really were underserved in healthcare. Again, Nashville has some areas that have a lot of providers in healthcare systems and some areas that don't. And predominantly North Nashville, which is a large portion of our African-American community, Southeast Nashville, which is a lot of our immigrant population. By the way, 12% of Nashville is foreign-born, so this is not an insignificant group of our population, as well as right in the center of town, right off the interstate at Nissan Stadium. We decided that we need to really focus testing there. And so we brought the healthcare leaders who've been working again independently to set testings in their own facilities and using their expertise and process engineers. We designed a plan for how we're going to test people. We decided we're going to do drive-through testing that has walk-up capabilities. We decided what information to get from people to make it efficient and effective, but also glean the information that we needed to keep the demographics and to make sure we're serving the areas we thought about that we needed. And, working with the Office of Emergency Management of the city, I think one thing is really important to realize is how healthcare systems take care of problems and come to solutions is very different than how an Office of Emergency Management or a fire department responds to crises. And so there was this very interesting initial kind of tension between the processes that, again, I've led and lead in a healthcare system. when I approached the crisis initially in that way and kind of building consensus and so forth, it was very hard initially, and it was really with the direction of the fire chief and the mayor that we decided, hey, we need to approach it more like a crisis and make certain decisions. And what was most beneficial was at each healthcare system, who are very fierce and healthy competitors of each other, donated their staff and their time to help us initially staff these resources. And I have to say that the final piece of the equation that worked, so we had staffing, we had a plan, and we had Office of Emergency Management that provided the facilities, was that we were able to have a great partnership with the state of Tennessee and the state health department, who provided actually the funding for each test. So they allowed us to work with private lab companies and to get the test run, which is not a cheap task. And that was very amazing. And again, partners such as the Nissan Stadium, where the Tennessee Titans plays, they gave us that facility for months to be able to run these testing centers. So it really was a big private-public partnership with both the city and the state being the public side.
Yeah. And I think another partnership that's really hard to overstate here was that with Meharry Medical College. Can you talk about how critical that was to the city's response?
Yeah. So Meharry Medical College is a historically Black college university here in Nashville that's been around since, I believe, 1874 or something to that effect. I mean, it provides, Meharry is very close to me, actually, because my father did his residency there. I went to high school a couple miles down the street from there, and would literally after school walk over there, whether it is to meet my father or work in a research lab. And it is led by Dr. James Hildreth, who is probably one of the most world-renowned infectious disease doctors anywhere. And we have him right in our backyard. And so it was really early on, one of the first people I reached out to was Dr. Hildreth, to see if he would help guide me and our city, both through the infectious disease part. And if you ever get the chance to meet Dr. Hildreth, he is an amazing communicator too. So I think he really brought a lot of knowledge to our city. But he also helped through, all right, here's the response, but let's be very cognizant of the fact that this virus will disproportionately impact anyway. And so they, being Meharry Medical College, provided, again, expert advice. They provided after the first 6 weeks, when hospitals started reopening, the staff that had been initially put at our testing sites had to go back and obviously staff the hospitals. Meharry Medical College provided staff and continues to this day. We're 120, 130 weeks in, to provide staff at our city testing site, one of which is still open. And by the way, that became a vaccination site we can get into. To this date, those city sites, staffed by Meharry Medical College, have tested over 400 or 500,000 PCR tests and have vaccinated over 15,000 doses of vaccine through just those 3 drive-up sites. Does not include all of the other vaccination and testing efforts that the health department has had with other entities around the city, including our big convention center in town, the Music City Center, which we had this mass vaccination event that the health department staff that did tens of thousands of vaccinations. And I think the key here is Meharry Medical College and Dr. Hildreth allowed us to have credibility and expertise so that those who are most at risk receive the vaccine. And what is really neat, I'm really proud of, in June of 21, so vaccination efforts really started in January and February. By June 21, so 3-4 months in, those 55 years and older who were most vulnerable of all the bad complications, 53% of our African-American population over that age were vaccinated, and 58% of our white population over that age were vaccinated. So these efforts, by very deliberate communications, placing testing vaccination centers in these communities, and having a trusted partner in Meharry Medical College to deliver the message and the vaccines, I think it led us to have that successful response.
Yeah, definitely. And what I thought was really interesting about your book was how you sort of tapped into your own personal experience immigrating to Nashville from Iran as a child, and growing up receiving services from the public health department and attending public schools. How did that background help inform you for what you were trying to do on the ground?
Well, one of the, and it is, I mean, Nashville's home. Nashville's given me so many opportunities. I mean, I learned English here, and as you highlighted, I did do those things. Initially, I think we didn't do a good job reaching out to our immigrant communities, right? Our predominantly, we have a large Kurdish population as well as a large Hispanic population in Nashville, and it once I realized early on that we weren't doing a good job, it hurt, frankly, because I've lived in those apartments. I've had parents that didn't speak English well. Some of the concerns around being around authorities and giving data, and so what I realized is that we needed to really get into those communities, and again, the best way to do it is have trusted sources and so there's organizations, Salome Health, Conexión America, and Turk. These are amazing organizations we have in the city that really helped us get into those communities and really be able to communicate and deliver care. And so initially I was a little disappointed in myself in our response because we didn't do a good job, but quickly once I recognized the failure, we stepped up, and my personal story definitely colored that.
Yeah. And so a lot of that was like a broader community response, but which was meant to keep surges, at a level hospitals would be able to manage. I think it's safe to say we cut it pretty close a couple of times. But can you tell us what it was like in Nashville's hospitals during those worst surges, and what challenges were they facing, and then how did you solve them?
Yeah, so I remember I take chief of staff call at Vanderbilt University Medical Center, and I remember December 31st. So right at this, that was probably the peak when we still we didn't have vaccinations, and about a third of our city's or region's hospital beds were at full capacity. I remember having to turn down referrals from as far as Virginia. People needed hospital beds, not just for COVID patients, but heart attacks, traumas, and these people, everyone wanted to help, right? HCA wanted to help, Ascension, Vanderbilt, but at a certain point, you just didn't have the capacity. And I remember talking to some of these people calling us, and they're saying, "God, we've called 20 people, 30 people. We can't get anyone to take care of these patients." And so our hospital leaders, after that peak, so by January, realized, gosh, we need to really come up with an innovative way to help our people in the city. Because what we didn't want to do is have people from Middle Tennessee have to travel to Virginia to get their care. And so I very much credit, Wright Pinson at Vanderbilt, Mitch Edgeworth, HCA, and Tim Adams at Ascension, as well as the Tennessee Department of Health that helped kind of facilitate and provide some of the coverage that, legal coverage needed. And we created what I think is one of the first in the country transfer centers, Middle Tennessee Coordinated Transfer Center. And so what this system did that we fortunately didn't have to use in January, and we thought we could shelf it, and when Delta hit, it was ready to go and was amazing, is we set up a system in which the 3 tertiary hospital centers would take transfers from any unaffiliated hospital in our region. So we set a geographic region of what that meant, and specifically for hospitals that were, again, freestanding EDs, didn't have an ICU, didn't have a specialty service available, and hospitals that at least gave it a good try to call 2 or 3 places to get transferred. And so if those hospitals didn't have were unable to successfully transfer patients, whether it was for COVID or for some other mechanism, they could call our Middle Tennessee Regional Transfer Center, which is a 1 number that was based out of VUMC, but the calls would get circulated. So 1 patient would go to HCA, 1 would go to Ascension, and 1 would go Vanderbilt, and we would do that consistently. And by the end of it, we had 838 requests for transfers in 3 months. So from August to November, and nearly 700 of those people were able to be transferred to a higher level of care in Middle Tennessee. And I think about the lives that we saved, the administrative burden that was taken away from patients, hospitals, and healthcare providers, because they didn't have to sit on the phone and call 20 or 30 different places. And it is a model that is very successful. It's a model that they've proposed in Germany, and I really think it has saved lives. And it was only able to be happened because we had 3 really innovative, strong leaders, and we had a state Department of Health that allowed us the legal coverage to be able to do it. And it only worked under the governor's emergency order, right? So I don't think it's something that one could just turn on at any moment, but it was a great, effective tool in a moment of crisis.
Yeah, and I think it's also important to underline these are three like fiercely competitive health systems: HCA, Ascension, and Vanderbilt. What was it like bringing all of those leaders together under the same roof?
You know, yes, you're right. I mean, they all do such great work, and they are just like most health systems, competitive. But surprisingly, it wasn't as hard as you would think, because all three of those leaders and all three of those systems really fundamentally want to take care of our region. And so, you have to have an honest broker. And in that case, I wore my city hat. I was not a VUMC doctor, and I was an honest broker, and we were very transparent with the data. So I believe every night, the transfer center data would be shared amongst all hospitals. So say, hey, these are the calls, this is where they went. I think, trust is the foundation of what made it successful. And these leaders had trust in the process, and they fundamentally believed that the people of Middle Tennessee need to be taken care of. And so, I mean, gosh, it was kind of a utopia, right? Frankly, but you're right. I mean, it's just like any other big city with a lot of very good healthcare systems. There's a lot of competition, but they wanted this people to be taken care of, and 700 people were able to stay in this region and probably have better outcomes of their medical condition.
Yeah, absolutely. So now, more than 2 years later, you recently snagged a new title with the UMC, Vice President of Business Development. Tell me more about that role and how the past 2 years of establishing these relationships with other systems and community leaders has prepared you to take it on.
Yeah, it's a really it's a humble opportunity that I've been given. I've been a Vanderbilt for 13 years, and in this role, I really work with the leadership of UMC to make sure that kind of some of the institutional strategies that we have set up, I can help develop opportunities that meet those institutional strategies. And I think one thing that the past couple of years have taught me that allowed me to hopefully do this job well is to perhaps bring together people and groups and organizations that perhaps historically had not been aligned, and find a common goal that we can all agree to and work towards success. And I'm really proud to be doing it with VUMC, an organization that I believe really cares about the people in the region, that provides an amazing, stellar service. And so if I can help continue to bring that care to a broader region, I'm really excited to do that. And so fun opportunity, and we'll see how it develops.
Definitely. Well, thank you so much for taking the time to visit with us at the checkup today, Dr. Jahangir. It was great talking to you.
Well, I really appreciate the opportunity, and thank you for chatting.